Hello everyone, this is Janosha and today me and my friends will be presenting on Aboriginal and Torres Strait Islander people's health. We would like to show our respect and acknowledge traditional custodians of the land, of elders past, present and future. Our lives continue to be enriched by their generosity and wisdom. Here on this slide, you can see the sections that we will be presenting individually. In this presentation, we will be having a look at the different aspects of Aboriginal and Torres Strait Islander people's health. Through analysis of the impact culture has on their health, health issues present in remote Australia, and necessary health interventions to counter these problems. We will also be talking about how we as nurses can ensure delivery of safe nursing practice for Aboriginal people. Now Menuka will be talking about the significance of culture in Aboriginal and Torres Strait Islander people's health.
Thank you, Genosa. Now, Aboriginal and Torres Strait Islander culture date back to as far as 65,000 years. Culture and traditions hold immense importance for Aboriginal people's life. This fact is reflected by the enormous impact that culture has on Aboriginal Australians' health. For Indigenous Australians, the concept of health is holistic, which views health as far more than just physical, mental, and social well-being. The holistic approach on health incorporates every element that is associated to an individual, such as traditions, beliefs, relationships, identity, self-esteem, and environment. There exist various aspects of culture that influence Aboriginal health as listed in the screen. For now, let us first focus on collectivism and kinship system. In contrast to individualist approach of Western societies, health in Aboriginal culture is viewed with a sense of collectivism. Social relationships and kinship are highly valued by Aboriginal people and play a vital role in their health. For instance, it has been observed that child-rearing practice in Indigenous society is guided by collective practice as everyone in the community feels responsible towards children's security. This facilitates children to bond with people and explore things without any hesitation, which can contribute to our self-esteem and well-being. Now, coming on to connection to the country, the traditional territories are termed as country by Aboriginal people. Land is regarded as mother and is fundamental to Aboriginal identity, spirituality, and well-being. A seminal study conducted by Garnett and Sithole suggests that behaviors related to connecting with country was proven to have positive impression on Aboriginal people's health, like reduced risk of diabetes and hypertension, lower rate of kidney problems, and low body mass index. There exists scientific evidence that activities performed in connection to nature, like horticulture and gardening, can enhance physical and mental well-being of a person. The third point on the slide is colonization and culture-blind policy. The years of colonization in Aboriginal history were entailed with elimination of indigenous people from their traditional lands, accompanied by exploitation of land and resources. This disrupted the connection between people and their country. As a result, the development of culturally appropriate identity in Aboriginal youths was disturbed and the essence of being Aboriginal was desecrated. On loss of autonomy and identity, the potential of living a healthy life in Indigenous people ceased as they were frustrated and involved in violence and drug abuse. The European conquerors believed that they knew what was appropriate for Aboriginal people and forcibly separated children from their families. The trauma inflicted by this culture-blind policy is still engraved in Aboriginal people's life and has led to issues such as identity crisis, alcoholism, child abuse, and women violence, which has deteriorated their health. To overcome this pain, Indigenous people often seek resilience through traditional healing. It includes activities related to connecting with land, culture, and community. Traditional healers use the knowledge from ancestors and medicine extracted from traditional bushes and herbs to cure people. In conclusion, cultural practices and values are integral to well-being of Aboriginal people. On occasion of failure to acknowledge this relation, the health and well-being of indigenous people will undoubtedly be compromised. Significant diversity can be witnessed in Aboriginal culture across the great nation. Every Aboriginal community holds characteristic traditions and values that are unique to them. To narrow down the scope of our focus, we will be just concentrating on the Aboriginal groups residing in remote Australia. Remote Australia constitutes 78% of total landmass of Australia. Geographical isolation, health inequalities, and diverse culture groups are the key features of remote Australia. Remote Australia can be visualized as mining towns, railway sidings, outback towns, accompanied by magnificent landscape, extreme climates, dusty roads, and wandering cattle and wildlife. The remote population is largely dominated by Indigenous Australians. One quarter of total Indigenous population reside in remote regions in Australia. There exist around 1,212 remote indigenous communities which are segregated from one another. One needs permit to visit these communities. Population is dispersed and the accessibility to infrastructures like transport, adequate food supply, and quality health service is limited. People are more prone to disease and have shorter lifespan. There is 1.3 times greater mortality rate and 1.7 times greater suicide rate in comparison to major cities. In context of medical services, there are Aboriginal and Torres Strait Islander primary healthcare service with emergency and visiting service provided by nurses with telephone guidance by doctors, but there are no inpatient facilities. Due to lack of resources, the scope of practice of nurses in remote Australia is wider, ranging from diagnosis to prescribing and management of the patient. Now, I would like to introduce my friend Kabita to provide an insight on health needs in context of remote Australia. Thank you.
Thank you, Menika. Remote Australian populations suffer with various sorts of chronic illness, among which a significant one is cardiovascular disease. Cardiovascular disease refers to all types of disease involving heart and blood vessels. The most common type of CVD are coronary heart disease, stroke, and heart failure. Cardiovascular disease is one of the leading causes of death in Australia. The main cause of CVD includes high blood pressure, high cholesterol, diabetes, depression, smoking, and family history. The main reason for choosing this healthcare need is that compared to non-Indigenous Australian, Aboriginal people were 70% more likely to die from circulatory disease. In context of rural areas, 1 in 4 people are suffering from CVD, which increase the rate of mortality and morbidity due to CVD in rural community, which is 1.8 times higher than non-Indigenous population. However, many of the risk factors of this disease can be prevented. Some of the modifiable risk factors include obesity, smoking, hypertension, and high blood cholesterol level. The chosen healthcare need can be benefit remote population as health promotion and health literacy on specific disease can help the community people work on their healthy lifestyle. People living in rural areas have poorer health condition and minimal access to health services compared to people living in urban areas. Therefore, they are more likely to suffer from serious health conditions such as diabetes, cardiovascular disease, and cancer. CVD kills one person every 12 minutes in Australia, and it is one of the major health issues among Indigenous people. In 2012 and 13, 12% of Aboriginal people reported having a diagnosis of CVD. In 2015, 14% of total deaths among Aboriginal people were caused by heart diseases. In 2012 and 13, 30% of Aboriginal people reported they did not have proper access to health services when they needed it the most. Whereas in 2012 and 13, 70% of Indigenous Australian is 15 years and over in urban areas receive good health services. Aboriginal people, when compared with other Australians, they are 1.3 times more likely to have cardiovascular disease and more than twice as likely to die in hospital from heart diseases. In conclusion, people living in rural areas have poor health condition, and poor access to health services, and people from Aboriginal background living in remote area have less ways to access to disease and to get information about different diseases. So appropriate health promotion such as workshop will reduce the mortality of patients from Aboriginal background. So that's all from the healthcare need. So to talk more further about the social determinants of health, my friend um, Janosha is coming. Thank you.
Thank you, Kabita. Now, as Kabita has spoken about the causes, we all know that the social determinants of health are the causes of all causes. We will now discuss the social determinants of health of Aboriginal and Torres Strait Islander people living in remote areas facing cardiovascular diseases. Social determinants of health are the combination of both social and economic aspects which are interchangeable and connected to each other. These include education, employment, working condition, housing, and of course, not to forget, racism. Racism is a social determinant which distinguishes Aboriginal and Torres Strait Islander people from others. While talking about racism, racism is one of the main social determinants affecting the health of Aboriginal and Torres Strait Islander people since the non-Indigenous people ruled. A survey conducted by Western Sydney University states that two-thirds of Aboriginal and Torres Strait Islander people are reported being called names and perceived as untrustworthy and disrespectful. Prolonged exposure to racism leads to excessive stress, which is one of the main causes of cardiovascular diseases. Racism eventually leads to ill health. The various pathways of racism which leads to ill health are limited or no access to resources such as education, work, housing, and health care, which exposes them to risk factors, including stress, mental health issues, and heart-related diseases. This picture here on the slide illustrates the pathways between racism and ill health. It shows how racial discrimination has an impact on the access to societal resources and psychological stress, indicating poorer living conditions, decreased quality of life, and negative coping behaviors, eventually leading to mental and physical health outcomes such as cardiovascular diseases. The next social determinant is transport. Aboriginal and Torres Strait Islander people face a number of barriers and incur difficulties assessing the right health care services and the needed support they require, as well as maintaining their cultural obligations. Barriers are highest in remote areas, where basic services may not be available in close proximity to established centers of Aboriginal population, and where demand for services exceeds the resources, structures, and personnel required to meet that need. Aboriginal people face restrictive public and private patient transport options. Furthermore, seclusion from community pharmacies and medical services has hindered appropriate access to essential medicines. Well, the government is trying their best to lessen the disparities faced by Aboriginal and Torres Strait Islander people. One such example is the Western Australia Department of Health. The Western Australia Department of Health have funded patient transport officers and patient journey officers to make sure that Aboriginal patients have suitable and sufficient transport services to medical appointments at all levels of the health system, including primary, secondary, and tertiary. Unfortunately, the provision of these services varies significantly across Australia, and access is not always assured. The other social determinant of Aboriginal and Torres Strait Islander people is unemployment and working conditions. Now, unemployment puts health at risk, and the risk is higher in remote regions where unemployment is widespread, causing illness and premature death. Unsatisfactory or insecure jobs can be as harmful as unemployment. Merely having a job will not always protect physical and mental health. Job quality is also important. Many a times, job insecurity has been shown to increase effects on mental health, particularly anxiety and depression. Heart disease and risk factors for heart disease as well. Also, having little or no control over one's work is particularly strongly related to an increased risk of cardiovascular disease. All these factors lead to stress, and stress raises heart rate. If the tension goes on for too long, they become vulnerable to a wide range of conditions, including infection, diabetes, high blood pressure, heart attack, and stroke. The next social determinant is food availability. Aboriginal people living in remote areas always have the burden or the pressure of healthy food availability. One such project, called the Remote Indigenous Stores and Takeaway, that is the RIST project, was established in 2005 by the South Australia, Western Australia, Northern Territories, Queensland, New South Wales and Australian government health departments to expand accessibility to a healthy food supply for Aboriginal and Torres Strait Islander people living in remote communities. This project aims to establish and improve standards for healthy remote stores. These are just some of the few social determinants of health, and there exist many other such factors out there that determine Aboriginal and Torres Strait Islander people's health. Now, GIU will be presenting on safe nursing practice. Thank you.
Thank you, Janosha and Vanessa. First of all, health professionals need to show the respects to Aboriginals and Torres Strait Islander people. Since the health disadvantage of Indigenous Australians is apparently devastating, nurses and other health professionals should realize that it is significant to respect Aboriginal and Torres Strait Islander and place the Indigenous perspectives and holistic health service delivery together. From the statistic, the mortality of Aboriginal and Torres Strait Islander people is related to health services which health professionals give to them. In another word, Aboriginals' health only improve if health practice become culturally safe, responsive, and congruent with cultural values, beliefs, and practice of Aboriginal people. To better taking care of Aboriginal people, health professionals need to be diverse to meet the patient's needs. Health professionals need to spend more time outside in the community rather than in hospitals taking care of Aboriginal and Torres Strait Islander people. It will be a big improvement of Aboriginal and Torres Strait Islanders' health by giving workshop of health promotions. Also, health professionals and Aboriginal people could communicate and share their perspectives, and health professionals will know more about Aboriginals' culture. Aboriginal people will have the guidance from healthcare professionals to speak with and who can provide families with support. Having a barbecue and lunch during Night Dog Week, Survival Day and other significant cultural events is an excellent way to introduce both health professionals and Aboriginal people to the community. It is a good practice to be involved in these activities. For example, if health professionals introduce cardiovascular disease in some remote area during this event or workshop, Aboriginal community in the remote area will give more chance to prevent themselves from such disease. According to the statistics, Aboriginal people have relative high rate of cardiovascular disease. For instance, Indigenous death rate from cardiovascular disease are 1.8 times higher than non-indigenous population. However, many of the risk factors of this disease can be prevented, such as obesity, smoking, hypertension, high blood cholesterol level. Appropriate health promotion, such as workshops, will reduce the mortality of patients from Aboriginal background. People from Aboriginal background living in the remote area have less ways to access the information of the disease, such as prevention, early symptoms, and mitigation methods, rather than people in urban area. As a nurse or any other health professionals, it is important to promote health in a culturally safe way. Health professionals need to become changed culturally and become more acceptable for Aboriginal and Torres Strait Islander community. Now, Manuka will be concluding this presentation. Thank you.
Thank you, Jiayu. Now we are near to the end of our presentation. Looking back, in this presentation, we talked about different determinants of Aboriginal health, the conditions of cardiovascular disease in a remote context, and how this health issue can be resolved through health promotion. We also provided information on how we as nurses can contribute in improving the health condition of Aboriginal people. We hope that we were able to provide a clear insight on remote Aboriginal and Torres Strait Islander people's health. Cardiovascular disease is a major issue existing in indigenous community, and it can be addressed through appropriate health promotion activities that take into account the social determinants of Aboriginal health. Nurses need to strive for cultural competence and effective communication skills to build a good rapport with Aboriginal people, which will assist to uplift their health status. Aboriginal communities were and are still exposed to health disadvantages. In order to bring a positive transformation in this situation, it is crucial that we work in partnership with Aboriginal people and take their perspective of health and well-being into account, as no one can understand their culture and problems better than Aboriginal people themselves. Saying this, we would like to conclude this presentation. Thank you.